Hello, hello, hello. Can you hear me and see me?
Oh, yes, we can.
Hello, hello, hello. So, let's see here. I don't, it's not bark all the time. I swear. What is it? I am Dr. Pam Turner. So if you haven't met me, welcome, welcome, welcome. I hope you're tutoring with one of my other coaches. And if you're not, if you're just in for a session with us, welcome, welcome, welcome. Let's just do a little get to know each other. So kind of tell me who you are and introduce yourself a little bit to the group. Great. I will start with Sandra Sanchez that I happened to meet yesterday.
Yes, hello, my name is Sandra Sanchez. And yes, I start the group yesterday. Have a lot of questions about the online videos and all that. I work as a substance abuse counselor for the past 13 years, and I just got my master's and social work last year on summer. So I took the test twice and I failed. So I'm trying to see if I can this time, be better prepared.
Very good. Very good. Nice to meet you again. Let's see here. I have a man in my presence. Johnny, I've seen you on my schedule, but we haven't met. You're muted.
No, we have not met. Yes, my name is Johnny. I had taken the test and didn't have enough time to complete it. I guess my thing is reading it and then going back over reading, and not quite getting the gist of it all. I'm glad that this is like looking at the information to look at what is some things that stand out that would get me to answer the questions a whole lot quicker.
Okay. Is my title today how to answer the questions or is it community?
How to answer the question.
How to answer the
questions.
question.
Very good. That's actually my favorite. Okay. Yes. Very nice. Very nice. Johnny, so we haven't officially met, but so have you asked for accommodations for more time?
Yes, I did. Yes, I did.
2 extra hours in a private room?
I have to send it in, but I'm
Okay.
sure my doctor already says no problem.
Okay. Very specific, 2 extra hours and a private room. We'll talk more. One of my only concerns always is when you get extra time, sometimes you go back and change the answers. And if you do, I'll hunt you down and kill you. So you know, I'm so serious. No one has ever said, Dr. Pam, I've taken this test and I changed 6 answers and I passed. Never, ever, ever. So what we do is if we don't know, we just skip. We just totally skip. Okay. And then if we we flag it, no answer, and then we come back to it. Okay. Okie dokie. Hello, Pamela.
Hello.
Are you on my schedule or one of my other coaches?
I am on your schedule. I think prep course.
Oh, okay. Okay. Did I see you? Did we meet yesterday?
No. I think I signed up a little too late.
Okay.
So I wasn't able to first session.
Okay. Okie dokie. Okie dokie. Let me see here. I'm missing some people as well. So tell the group about you.
My name is Pam. I have taken the test several times. The closest that I have came was when I did Dr. Pam boot camp. So I came on back to get more tutoring and learn more from Dr. Pam.
And where do you live?
I live in Michigan.
Michigan. And Johnny, where are you? Sorry.
I'm in Wisconsin.
Okay. And Sandra, you're Arizona?
Washington, D.C.
Washington, D.C. And Yushana.
Yes.
How are you?
I'm well. How are you?
I am good. I am good. I'm trying to get people in my group that are normally here. Welcome, welcome. And tell the group about you.
My name is Yushana Sellers. I've taken the test quite a few times, and that's why I'm here to learn how to actually answer the questions. I am currently working as an early intervention specialist with children from birth to 3. And I am looking forward to taking this test so that I can pass it.
What do you want to do once you pass? What will your life look like?
So once I pass the test, my life is going to look like working for an agency. I want to do individual counseling.
Okay.
With parents, with the parents of the early intervention specialists program that I'm working with now. So I'd like to go on the counselor side and work with the parents.
Okay. Very good. It's a yucky rainy day here. I just need to close that window. Okay. Didn't get a leak. Okie dokie. And where do you live?
I'm in Grand Prairie, Texas.
Texas. I have a lot of people in Texas. Hello, Linda. How are you?
Hi, Dr. Pam. Hi, everybody.
Hello.
Hello.
I'm in Tennessee. I'm studying for my LCSW. I've taken it a few times as well, always within less than 10 points.
You live out there in Memphis, right?
I am.
Yes, we don't consider that part of Tennessee. Y'all just, it's a whole different world out there. You don't even eat the right barbecue.
Oh,
So Chattanooga is the furthest college from Memphis.
mhm.
So when kids grow up here, they want to go to Memphis for college because that's a further state school away. And when people from Memphis get up far away from their mother on a state school, they come to Chattanooga. So it's a farther state school. My middle child, of course, she wanted to go as far away as possible, and that was her first choice. And we went to visit, and she was very disappointed. So it was very much more of a commuter school. And when she was young, when she was all of 18, she just wanted to be on campus and hang out with all the kids. So she ended up going to Kentucky, which was still far away. So I don't know how that helped. But anyway, so tell us some more about you.
I currently work work on a crisis stabilization unit on weekends, and I work for individual therapy through the week part-time.
Okay. So if we talk about doing therapy, tell me which clinical theories you're very comfortable with.
CBT.
Say again.
CBT,
Okay. Which is?
cognitive behavior therapy.
Which means?
Thinking about your behavior, trying to restructure your behavior, I guess.
Got it. So CBT is changing your thoughts, feelings, behavior. You got stankin' thinking, Dr. Phil would say, right? So the problem is we're trying to restructure your thoughts. If I can change your thoughts, I can change your feelings and therefore your behavior. Okay. DBT, Marsha Linehan, right? Marsha Linehan does dialectical behavior therapy, and that's going to be for my borderline personalities, right? So that is, if we change your behavior, change your behavior first, then I can change your feelings, and then I can change your thoughts. So she is the opposite. So CBT is Beck, and DBT is Marsha Linehan. And as we go over test questions, what you'll find so many times is the theories are in there. They just don't mention the names.
Right.
Right. So you're like, I'll say, yeah, I know you had Carl Rogers questions. Carl Rogers is the expert, right? He gives unconditional positive regard. And he says that the client should the therapist should just be there and not say anything and support the client. And most of us then use some form of that, but we still don't always recognize it in a question. Okay. So really it's what we're going to do today. So we look at questions, look at content as well as how to answer them. Okay. Let's see here. Latrell, I am sorry that you didn't get one. I'm not really sure where have you got an email at all except for me? Is my staff working today?
I didn't get anything. I don't have anything.
Wait, can they help me? I have to get onto that afterwards. I apologize. I'm going down through my sessions this week and trying to figure out where are my social workers? Okay, so go ahead, Latrell. Introduce yourself, please.
Hi, I'm Latrell. I call myself the repeat offender. Um, I'm not giving up, and I encourage everybody else, don't give up.
Giving up is not an option.
It's not.
Not even close to an option. So we just keep going until we get it. And most often, once we get the key, we're really missing something sometimes. And that's what we really want to focus on is what's the piece that you're missing? How come you're struggling with the questions? And that's what we're going to work on today is really questions from all areas of really understanding both content as well as how to. Okay. Hello, Tony.
Hello.
How are you?
I'm doing good. I'm in the back seat of a car, so if it looks like I'm moving, my husband's driving.
You know, Dr. Pam says no driving. So hello,
Yeah.
Tony's husband as well. Thank you for driving her.
He says, "Yeah, no problem."
Okay, so introduce yourself to the group, please.
Hello, everyone. My name is Tony. I live in Texas. I work remote as a care manager for a hospital. I have never taken the test, so I am here, and I should be taking it soon, hopefully. But yeah, that's a little bit about
What's your test date?
October 12th. Yeah, October 12th.
Okay, then you're gonna blow today away, right?
Sure. Yeah.
That's so we're going with that, right? Very good. Nice to meet you. And Tasia, long A.
Tasia, yes, ma'am.
Okay.
Hi.
I
Hi, everyone.
told you
I'm
after
Tasia.
about 15 weeks, I'll get it. Just give me.
Yeah, no problem. I'm in Georgia. I've taken the test twice. The last time I failed by 8 points. So my goal is to find what I was missing and go back and come out with a pass.
Okie dokie. The way that I start off every week, and so I have Friday a group every Sunday from 6 to 7:30. On the Facebook site is the title. So if you're in my prep courses or tutoring with any of us, group is included in the price that you already have. So that's just something. It's important, I think, also to get to know other people and to realize you're not the only one, especially when you're trying to take a test and you're thinking, oh my gosh, I'm the only one that can't pass it. And that's just not the case, not at all. So I like the fact that we have other people that kind of are able to join the group. So tonight I'm going to talk about how to answer the questions. But before we get to that, I opened it up to the floor for questions in general. A test you've seen on Pocket Prep, TDC, RayTube, ABCDEFG tube. I don't care where you've seen it. A question you might not understand. Anybody?
I can't, and I know you talk about this every Sunday, and I told myself I was going to take a picture of it, and I forgot. But I have questions about like group questions. Anytime, and I guess it depends on the question. That's probably what you're going to tell me. But anytime I see a question about a group, and let's say someone in the group is saying something, there's always an answer choice of talking to that person individually, or
Nope.
waiting.
That's never the right answer. Never the right answer.
Okay.
The only time it's the right answer is if there's if I have to make a CPS report or Adult Protective Service report. The group is your client. Okay. So I can never separate them separately unless there's something that I need to report and there's no need for the group to hear that. So I might just say, hey, Bob, can you stay around after us for a minute? So let me talk to you, something like that. But other than that, what is said in group stays in group. They're all my client.
Got it. Thank you.
Okay. So, the same with the family. So if you're seeing a whole family and let's say dad wants a copy of the records, do you know that everybody has to sign the release? Children aren't old enough to legally give permission, but they give assent, which is verbal permission. Okay, ASSENT. So someone who is 15, 16, and they can't legally sign any document, but they can get assent, ASSENT. Okay. I usually ask that you don't take notes because it's recorded, and I promise you'll get a recording, Sandra. I did not get that one up yesterday. I haven't gotten any recordings up this weekend, not yet, but I will get it up, I promise. But what happens is I'm really going to talk really fast on purpose because I'm trying to brain dump. I'm trying to give you everything I know in this hour and a half. I want you to make sure your closed caption is on so you can see my words. We've always got to increase our vocabulary. So at the bottom, you should see CC, And that's your closed caption. And please don't change the language. If you do it, it changes the language for everybody. So if you please don't do that.
How do I do that? Close caption.
So I don't know where it is on your screen. Okay, but I can tell you somewhere.
Caption.
Everybody in? Okie dokie, okie dokie, okie dokie. So in general, I'm just going to pull up some questions. I'm going to try to go to cover every area. If there's something that, put that link in there. If there's something that you particularly want me to cover, I will, but we're going to talk about just how to answer the questions and looking at content. So the first thing we're going to do, there's a formula. And I know that many of you have heard about the acronyms, the eat pie, eat cake, safari. Let them go. Let it go. Okay, just let it go. Really, I think so many of us get lost in the acronyms that we're lost in the question. Okay? And we don't want to do that. We don't want to get lost in the question. We want to figure out what the question is asking us. Sorry, just sending a new couple links out there. Okay, so let me go. I'm going to go to groups because you brought up a question that I really like. Is there anything else in general that you want to ask me?
Yes.
Go ahead.
I had a question today on Coffee Crib about the psychoanalytic theory.
Which is? Who's that?
What is?
Who is psychoanalytic? Got it.
Freud.
Okay.
And the question asked, which of the following refers to the mediating influence of the mind in the psychoanalytic theory? And the options were superego, conscious.
Whoa. Go back to my question. What's the question to ask you?
Mediating influence on the mind.
Okay, all you did was repeat it in paraphrase in your own words.
I just thought you wanted me to tell you what
No.
No.
I need you to understand the question. You're just guessing if you don't know what it's asking you.
But that's the problem. I didn't understand what it was.
So
asking,
let's figure it out. Let's figure it out. Is that on what pocket prep? The LM?
LM.
Yes. See. Let me see if that's my question today.
It's today's question of the day.
Okay. So let's figure out what the question is even asking me. Okay. So tell me what you know about the id, ego, and superego.
I know that the id is the pleasure-seeking portion.
Eat, sleep, and have sex, right? Freud said society will not exist if our id, we're born with our id, right? My id says, girl, you single, you almost 59, you look still okay. You go out tonight. Come on, right? That's my id. What does my superego do?
I think that's like our behavior or something. Or
if this is the devil, what's this?
The angel.
Ding, ding, ding. My id's going, come on, baby. Let's go out. Football, you get some guys at the bar. Come on. My superego goes, girl, you got to go to work and you old. Get your butt in bed. Right? Like, oh, I want to. Oh, you get. What does my ego do?
I don't know. He's like the middleman. I don't know.
Ding, ding, ding. Ding, ding, ding. He's the middleman. He's the balance, right? So my
Mhm.
id says, go, baby, go. Okay, my favorite food is to have like order pizza, leftover thin crust pizza with pepperoni and sausage. And in the morning, put eggs and cheese on it.
Wow.
Oh my God, that is heavenly breakfast. My id says if you order pizza tonight, fam, you can have pizza breakfast for breakfast in the morning. My id's like, come on, right? Okay, I throw some spinach on there occasionally to make it look like I'm healthy. My super ego says, girl, have you looked at your butt? You cannot do that. My ego says, hey, baby, let's get maybe a slice of pizza, right? And a salad, right? So my ego is trying to keep both of those in check.
Mm-hmm.
Personally, my ego has to work harder than some people's because my id wants to win. Okay. So the ego is the part that we work with.
Mm-hmm.
Ego defense mechanisms. Johnny, I'm gonna beep you. I'm gonna put you on silent, okay? Because we ain't in church. I can't have you amen in every time. Okay, so my id is my pleasure. Super ego is the angel, right? Evil angel. And then the ego keeps us both in check. Got it? Okay, so now let's go back to the question. So ask me again, try to explain to me what the question is asking me. What does the term mediate means?
Like bring about? I don't know.
What's the mediator do?
Balance.
Balance.
So which of the following refers to that balancing influence of the mind in Freud's theory?
Right. Okay.
What's my
now
answer?
It's clicking. The ego.
Ding, 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 ding. Okay.
Okay.
So when there's a word you don't know, and there'll be tons of words you don't know, let's not pretend. That's one of the reasons that my closed caption is on. You have to increase your vocabulary. But you know what? Figure out this word. There's some part of that word that you know, isn't it? So what happens with most of us is we see a word we don't know and we freak out. Either we skip it, we try to make sense of it. We can't do that. Because remember, this test is
sometimes it threw me off too.
okay. So while we're studying, we're going to Google it. Okay. While we're studying, we're just going to highlight it. And this is not a clinical term, So I'm going to copy it and I'm going to go to my and I'm always going to put in plus counseling or psychology. So this is not a term. It's not a clinical term. It's an everyday English term. But if I put in plus social work, it's going to give me a term that works well for me. And not only am I going to do that, I'm going to actually keep a list of words that I'm learning. Anybody got kids? Y'all know y'all have to mediate, right? That's one of the roles that social workers play. We play the role of the mediator. Okay, so that is the word. So advocacy, mediator. I have girlfriends that own their LCSWs, and they own a mediating business. So they charge just a little bit less than lawyers do. Oh, do you know? So when a couple's going through a divorce, so the lawyers charge you an arm and a leg to try to find who gets what. That's what their business is. They're LCs. So they definitely have a much better knowledge of families and how families get along. And that's their business. They try to save you money by keeping you out in front of the judge, but they don't charge much less than attorneys. Okay. And they know people better because we know people better than attorneys do. Okay. Makes sense? Okay. Got that question out?
Yeah.
Okay. What I normally say is I say BIPOC give prep about 6 to 8 weeks before your test. There are only so many questions. And if you're getting better, it's not because you're learning anything. It's just because you've seen the test questions over and over and over again. So the goal is really, I do like it as a tool for content. I really do. One of the best tools for content, not one of the best tools for how to though, right? Because most of our questions are very much recall questions. They're very black and white ones. And that's not really what we're looking for on the test, right? Most of our test questions are a little bit different than that. So let's start off with some group questions. Okay. So what I didn't do, so let's go back and talk about how we answer the questions. Okay, so I am a fan of the problem-solving method, which is the basis for all of the acronyms. Okay. We get paid to be nosy. That is our job in life, is to be nosy. I'm going to put this link in your chat box, and I want you to download it because I want it to be in front of you. That talks about the whole process, but I really only want you to focus on where we're at. So that's like the third slide. So I put it in your chat box. If you right click it and download it, so you can be looking at it as we're doing questions. Okay. So assess, 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 assess. Whether it says first, next, best, I'm trying to make sure I have all of the answers. We get paid to be nosy. We get paid to ask questions. That's our job. Okay. So then if I can't assess, I'm looking for things that might cause me to not be able to assess. That might be feelings or safety. Now, some people will focus really much, a lot on engaging. I do like to engage, but that's not what I'm going to focus on. If I have to engage, if I can't assess, if they're not bonding with me, I go back and I put engagement before assess. Okay. But I'm just start thinking I always think at the question, assess, 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 assess. Okay. Then I'm going to remember that I plan with the client, never, ever for the client. And termination starts at the beginning. Okay. So the rest of the acronyms, just let it go, let it go, let it go. TDC, I think, says put it in order. I don't have room for that either. Nope, I'm not going to do that either. We're going to simply read the question, understand the question, and put it in your own words. So we're going to spend most of our time on the question today. What is the question asking me? Every question measures a KSA, knowledge, skill, or ability. The first question that you had for pocket prep, that was a knowledge of knowing Freud. Right? That was knowing our Freudians and what's unconscious and how we bring things up from the unconscious to the conscious. That's all that question was asking, and knowing that terminology. So every question is measuring something that you learned in social work school. And this process you learned in social work school, you either had a general methods class or general practice class, and this is where you learned to do this. Right? You learned the whole process of social work, that there's an intake. Someone, usually not you, right, decides how people get to see us. So they call up or they go online, or somebody decides if our agency is a good fit for them, right? That's the intake process. Then they get to us. We assess, assess. We come up with some sort of, and you might see the term case conceptualization. Instead of diagnosing, sometimes you'll see that. I've got a really good idea of what the problem is, right? So then I'm going to, that's my diagnostic. I'm going to come in. Now that I've assessed, we did the intake, we've assessed, I know what the problem is. We're going to write the treatment goals with the client. Treatment goals have to be SMART goals, right? Specific, measurable, achievable, realistic, and time-based, right? Okay. And then, so every time a client comes in, we are driven back to the treatment goals. Right? That's where all our sessions come in at, is where are we at on those treatment goals. Okay. And my treatment goals are based on my theoretical orientation. What that means, if I'm a CBD person, this is how I write my goals. If I'm a family theorist, my goals are written on the theoretical orientation I'm using. Okay. Makes sense? Okay. And it doesn't really matter who's your client. Whether it's a couple, a family, an individual, a community, we still follow the same process. We don't go in a community and tell anybody what to do we? The first thing is called a needs assessment. That's where we start. What does the client need? The stakeholders are our community. That's our client. So don't be scared of community questions. That's how you all got to be here. Somebody stood up for your right to vote. And somebody stood up for women, people of color, anybody. We got here because of community work. One of the reasons that, oh, by the way, if you don't know, Barack Obama is in love with me. He's in love with me. I have erotomania. It's a belief that someone famous is in love with you. So he's in love with me. That hasn't changed. And remember, you cannot ever question my delusion. It's my delusion. You don't get to question my delusion. Stay in me. However, one of the reasons that how I fell in love with him, he loves me too. But he did community social work. That's what he did. When he first started, he started out in the projects in Chicago, really getting the clients to come together to get the landlords and the government to, make sure they had heat, make sure they had water, all of those things. And we do that on a grassroots level, making sure that we have enough people to do that. Okay, I say that to say, now we're going to start looking at questions. Okay, I'm going to pick up group questions. That's because you started there. All going to follow the same process, no matter what, even if I know the answer. Okay, and if you've been with me for half a minute, you might have seen the question. If you have, let me know and I'll pick another one. Okie dokie, we're going to go in order. So let's go. All of you have to read out loud. I'm sorry, because it's just the rule. Let's make good recording. So I'm going to start with Yushana.
Okay. A head injury rehabilitation group meets 3 times per week. One patient tells a fellow member that she is not working hard enough in physical therapy. The group's informal norm is that critical or negative sentiments are not to be expressed on Friday. They have found that members are often distraught and cannot deal with such issues over the weekend. With an angry edge, members of the group aggressively correct the member. The social worker would.
Okay, so we're going to stop there and figure out what the heck they're even talking about. Now, in a group question, it matters what stage of group we're in. Okay, so Apgar in the book talks about pre-affiliation, the Boston model. I teach storming, norming, then we're going to perform, and then it's over. That's the Tuckman model. Okay, so then what we know about group in the first stages of group, they're just talking to me. They're not looking around at anybody else. They don't know anybody, right? They're all just staring at me. Then what happens is, when we get closer, we begin to storm. A test question might say, somebody says, 2 people start fighting over a chair. Or somebody says, to the leader, you ain't never used drugs. Why are you leading this group? Right? So that's a storming process. Let it go. It'll pass. Of course, they can't be throwing chairs, but that's normal part of group. We're jockeying for spots. We're trying to figure out who's the big dog in a group, right? Then we norm. That means we set the group norms. The rules I set, the group rules I set in the beginning, right? This is what you'll do. This is what you'll do. This is what you'll do. The norms are how people behave in group. If every week we come in, we know that, Pam's going to be late and Bob's going to be bringing coffee and Sally always bakes and she bakes for the whole the class. As long as a group agrees, I don't care. Every group has their own norms. And then they're performing. That's when they're tight. We can disagree all day long and still be okay. We can even be in different political parties and still be okay because we're tight. We trust each other. And then group is over. Okay. So let's start with, what stage of group do you think they're in?
So it's like they're not seeing eye to eye.
Well, keep reading.
Okay, they found that the members are often distraught and cannot deal with such issues over the weekend. With an angry edge, members of the group aggressively, correct the member.
So wait a minute. When I say the question, and I know some of the theories say just read the last line, I want the whole thing. Everything in the question has meaning. It's like scripture. When they mention the woman with the issue of blood and she ain't got no name, it matters. Every word in that question matters. I don't believe in what they call those distractors. No. Okay. So read from the beginning for me.
Okay. A head injury rehabilitation group meets 3 times per week. One patient tells a fellow member that she is not working hard enough in physical therapy. The group's informal norm is that critical or negative sentiments are are not to be expressed on Fridays.
So if they have a norm,
Mm-hmm.
what stage are they in?
Oh, I have to go back and read all this.
Okay.
I
So
totally forgot all of this.
norming.
Yes.
Okay. So norming or performing, right?
Yes.
Does everybody see that? It's a reading test. If I haven't mentioned that to you 1,000 times, I will. It's a reading test. Every word in there, they're giving you hints and keys. It's not a guessing game. I promise you it's not. So if they've already, the group came up with their informal rules. So they're probably performing. They're tight, right? They're tight. They're tight. Because they already set the norms.
Okay, yes.
Okay. Now, little Bobby here comes in, and even though they have the rules, what did Bobby do? The guy who said something. Right? Even though there are rules, he still broke the rule. Okay. So now keep reading.
They found that members are often distraught and cannot deal with such issues over the weekend.
Okay.
With an angry edge, members of the group aggressively correct the member.
Okay.
The social worker would.
Okay. So again, tell me in your own words. Let's make sure we understand the question.
So they're in group, and some of the members feel that a member isn't working hard enough in the group.
One member, one guy says it. Okay.
Yeah, one patient.
Okay.
And what else? They've already made some rules of the group that certain things can only be done on Fridays. And let's see. And they found that, and some of the members are distraught. They can't deal with.
So in this one, they're not distraught. But what they found is in the past that if we bring up things on Friday, it really upsets us.
Okay.
So we're not going to bring up upsetting things on Friday.
Okay.
Okay. You see that? So now that there's some anger in the group. Ooh. So
yes.
What should I do first? They're aggressively attacking the one guy who said something. Okay, we see that?
Yes.
Okay, don't worry. I'm gonna pick on everybody the exact same way. Don't take it personally.
Oh no, I'm not. I'm trying to gather my thoughts.
I'll
just gather my thoughts.
And I speak really fast. I do on purpose. Okay. So now I understand the question. And no matter what it says, I'm thinking, what would I do first? Okay.
So in group, the group should work things out among themselves? No?
Well, let's see what their 4 choices are.
Okay. Reflect with others that has comments with inappropriate, comments were inappropriate for a Friday session. Encourage the group to examine why the behavior is unacceptable. Indicate that the group is being rigid or support the member while also allowing the group members to express their feelings.
Okay. So what am I going to take out? We're always going to take out 2. No way, no how.
We're going to take out number 1.
Okay. And why?
Others that his comments were inappropriate for the Friday session because the group already, let me see, it's something with this sentence that you have highlighted. Okay,
so I just pointed out to show you what stage they're in. That's the only reason I pointed that out. So it's not have to do with everything. It's just that one, and it's just about that one that they were in the formal group. Okay. So reflect with others that his comments was inappropriate for a Friday. That's true. That is true. Let me keep that in for a minute.
Okay.
How about 2? Encourage the group members to examine why the behavior is acceptable. is unacceptable. I'm taking that one out.
Okay.
You know why? Anybody?
It's not the group's job to examine the person that said its behavior.
No. Go back to the question. No thinking. What words in the question support the answer? They all agreed. Even the guy said he agreed. The norm, he agreed. He was up in there said, no, we ain't doing this on Friday.
Oh,
you don't have to examine why the behavior is unacceptable because y'all already agreed. It wasn't me. It was a group norm. I didn't set that rule. I did. Okay. So that one's out for sure. Okay. So when and I'm sorry. So when I say why, if it's a recall question, that means I have to know content wise, right?
Right.
So if I ask you the stage, you have to know the recall. But if I ask you why here, it means what words in the question prove it to me.
Okay.
Okay. We always have to go back to the question to prove it to me. So now I took out 2. I'm between the 3 and 4. So of those, let's take out one of those at least.
Indicate that the group is being rigid.
I'm going to take that out. I'll tell you why. Because the word rigid almost always belongs to minutia. Structural family have rigid boundaries. Okay. So just that word right there is a family term. Okay. So, and there are other reasons, right? But because they already said the rule, but rigid almost always belongs to minutia. So now you're between 1 and 4, and they're both kind of alike. Do you guys find that in questions? You get down to the 2, and now you're like, oh my gosh, what do I do? They're both kind of alike. So this is where I'm going to read the 2. I'm going to compare the 2 to each other and see which one I can maybe prove in the question.
Okay, so reflect with others that his comments were inappropriate for a Friday session, or support the member while also allowing group members to express their feelings.
So when it says reflect with the others, that word matters. What is reflection?
To reflect on something, get the knowledge.
Nope.
No. Oh, no.
Reflection always means feelings.
Feelings. Okay.
Always means feelings. It's one of those active listening words that we use. They're always on the test. So reflection means I'm going to respond with the feelings that the clients didn't say.
Okay.
Right. Okay. So as we're going through this question, I bet that you are so anxious and you would like to just disappear off this camera.
No, because I know I need this.
Okay. So that don't mean the feelings ain't there, are they? That don't mean the feelings ain't there. Okay. It does not.
Okay. Yes.
So all I said was the feelings that you didn't say. That's reflection. It doesn't mean you're not going to stay here. It doesn't mean you're not going to do this. It just means that, hey, I'm anxious right now. First. Okay. That's reflection. So do you see how all those little things get so complicated in trying to answer just one question?
Yes.
Okay.
One question. Yes.
So now I'm deciding, is reflecting with the other group members that his comments were inappropriate, or do I support the member while also allowing the group members to express their feelings? Ooh.
I'm going to say,
I won't ask you why either way. So
I know. To support the member while also allowing the group members to express their feelings.
Okay. That is not the right one.
That's not.
Nope. So
okay.
Tell me why you picked that one.
Because and see that I think this is one of my problems with this test. Is because with group, it seemed like I remember that you allowed the group members to, speak among themselves to try to
support each other.
Yeah, I do. Okay. So then
try to work their disagreements out amongst themselves if they were to have them.
One is the better answer if I'm working with the whole group.
Oh.
4 is working with just one guy saying, hey, you guys stop being mean to him.
Yes, that makes sense. Yes.
Right? Does everybody see how that's, so that is true. Then everybody's my group. Now, if this were early group and it was the beginning of the group, would I let somebody beat up on them?
No.
I would not. And that term scapegoat in the beginning of group, they're picking on this one person, right? They're all blaming him for everything. But in this group, we've been meeting for 3 weeks, and you knew the rules, dude. You know, go open your little mouth after you said this. I'm sorry, I can't support you. I'm going to support the whole group.
Okay.
Okay.
Yes,
that was hard. Everybody see where we're at and how I got there.
Yeah.
Everybody glad y'all didn't have to go first. They're all so thankful to you. They're so glad. Okay, process it with me. We're social workers. We process the heck out of everything.
Yes.
Ask me questions. Did we see how we got there? Pamela, you look confused.
I'm not confused, but I did kind of go with support too because yeah.
So when I get down to 2, and that's the test is purposely written that way to get down to 2, and they sound very similar, don't they? So what I'm trying to figure out is how they're different and which one best answers the question. So 1 says reflect the feeling, share the feelings that the other group members are feeling about his comment on a Friday. Right? So that's the group answer. That's talking to everybody in the group. 4 is support the member while allowing all group members to express their feelings. Dude, you broke the rules, but I ain't gonna let everybody beat up on you. You knew better, right? We're all upset with you, Bobby, for bringing that up on a Friday. Okay. I know. Did that feel like a typical test question and you're struggling? No, I have no idea what to do.
Yeah. Yes.
Okay. Okay. Everybody gets a chance to suffer. Don't worry. It's equal opportunity pain. Okay. Okie dokie. Again, we're going back to the question. We're always going back to the question. What words in the question? Prove it to me. Okay. I got 3 screens open. Just try to move some around. Put you over here. Here. Out. 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 Okay. You. Myself. Save. Okay, here we go. Okay. This is a diagnostic question. Okay. Oh, let's see who's next. And remember your order because I'm going to try to call you again in the same order. So remember your order. Okay. So Yushana was first. Sandra, 121. Look at that one for me, please.
A 55-year-old woman whose husband died 18 months ago, seeking help from the agency. She complains of reduced appetite, weight loss, insomnia, frequent thoughts and memories of her late husband. In addition, she experienced feelings of despair, hopelessness, and believed that she could be better off dead. The most likely DSM-5 diagnosis could be.
So stay in my question.
And this is a woman who's 55, who's came to the seeking help after her husband has been died 18 months ago, and she is complaining about insomnia, appetite, lost weight, and she seems a little bit, well, frequent thoughts and memories for her late husband.
Okay.
And also she has been experienced feelings of despair.
So it's been 18 months, right?
18 months,
Okay.
18
And
months.
these are her feelings, right? Just reduced appetite, weight loss. She can't sleep. She keeps thinking about her husband. And in addition, she fears despair and loneliness. And it even had some suicidal ideations, it looks like, right?
Yes.
Okay. So let's read all four.
Number one, kleptomanic personality, major depressive episode, no normal behavior, anorexia nervosa.
Okay. So let's stay in my question. So what is cyclothymia?
Tell you the truth.
Anybody? What's cyclothymia?
It's a mild form of bipolar 2,
Okay. So how long does it last?
2 years.
Okay. 2 years in adults, 3 years, 1 year in children, and 2 years in adults. Okay. So it is a little bit lower. Let me show you what it looks like. So it's not quite bipolar 2. Remember, bipolar 2 is having that full-blown manic episode. I'm sorry, bipolar 1 is having that full-blown manic episode. Bipolar 2 is you're not quite having that episode. You are having 4 days or less. Am I sharing my screen? Do you see my?
Yes.
Okay. So major depression is 2 weeks, right? So then if I have major depression, 2 weeks or more, but minimum of 2 weeks, and my behavior goes all the way up to the top for at least a week, 7 days or more, have all this bizarre behavior. Kanye West, that's what I always say when he was telling us we wanted to be slaves and the Jews didn't matter, blah, blah, blah. That's bipolar 1.
Right.
You'll come back down to have a full-blown another major depressive episode. Bipolar 2, you have a hypo, HYPO, less than episode. And if it doesn't meet the criteria, even for bipolar 2, it's got the ups and downs, but not quite the bipolar 2. It's cyclothymia, 2 years in adults, 1 year in children. Dysthymia is what it used to be called, is now called persistent depressive disorder. And it's the same time frame. Persistent depressive disorder is 2 years in adults, 1 year in children. Okay. Okay, let me copy your image and I'll put it back on the test question. Okay, so now, do you know what everything else is? Yes, you know, the rest the question, all the other three are?
Major depressive disorders, episode, normal behavior, and anorexia nervosa.
Okay. Even if you know the answer, we're still going to rule out what it can't be. We always rule out what it's no way, no how.
Number 2, because
Okay.
according to the pictures you just showed.
Okay, so what else can I rule out? Not the answer. Okay, I'm ruling out number 4.
Right.
Okay. Oh, did your voice change?
No,
Okay, I heard like a deep voice there for a minute. Okay, so
I don't know.
I thought, you know, maybe there's some transgender issue. Oh, maybe it wasn't you. Oh, okay, because
What happened?
somebody with a deep voice answered a question that wasn't his.
Okay.
Okay, so I've only taken out anorexia. Anorexia is the eating disorder, right?
Exactly.
Okay. I don't see any proof the question of an eating disorder. I'm going to take out number 1. I don't see anywhere where it's been 2 years. Do you?
No.
Okay. And do I see any high episodes where she was excited, she couldn't sleep, she was like,
Nope.
okay. So I'm going to take out 1. It's 2 years in adults, 1 year in children. So now I'm between 2 or 3, and I have to go back to the question and prove it.
Okay, let's see. She's 55, going through insomnia, frequent thoughts, despair, hopeless, and believe that she could be better off. Depression, major depression. Number 2, I think.
Okay. And what
Yeah.
words in the question support it?
Despair and hopeless.
Very good. Okay. So I'm always going back to the question. Even if I think it's right, I go back to the question. What words prove it? That's how I know. So how come it's not normal bereavement?
Because it's been, 18 months,
That's it. That's it. That's it. That's it. That's it. That's it. Okay. So usually, and there's not a time frame anymore for bereavement. But what we look at is it should be getting better and not worse. If it's getting worse, not getting any better, now that bereavement has turned into a major depressive episode. Okay. Everybody see that?
Hmm.
So that's one that would be on both of my tests, the LM as well as the LC. So that's one of those very simple, straightforward diagnoses.
So it's number 3. The current is 2.
Oh, I'm sorry. I did the wrong one.
Right. Yeah, you got, you're like, okay.
Yeah, no, I'm sorry. There we go. I am not trying to make you more confused. That is not my goal today. Okay. Okie dokie. Anybody got questions on that one? Okay. Those are ones that are almost always going to be on there. Those are very simple ones, knowing, what is between bipolar 1, bipolar 2, and just simple diagnosing. Okay. Okie dokie. Let me go back here.
Dr. Pam,
Yes.
would it be feasible? Because I did pick the one major depressive disorder, but also, wouldn't it be more knowledgeable to get a understanding of how long these particular symptoms last to be able to come up with the correct diagnosis?
So I told you though, right? We went over it and I said, how long is major depression?
Yeah.
Mhm.
2 weeks. I said that. Okay. Anorexia, I don't, so in that question, I wouldn't take the time to teach you that because I know that's not an answer.
Right.
Okay. So, but yeah, so you need to know what major bipolar is major depression is 2 weeks. I told you about my bipolar 1, right? That's 7 days. So yes, those are things that you need to know. Okay. Okay, I'm doing recall questions where I'm just seeing if you know content. So we have to know both. So that's what we're looking at. Okay, so let's see here. Who is next? Trying to go in my order here. That's going to be you, Mr. Turner. Do you see 70?
Yes. Which of the following is an example of double bind communication?
Okay.
Number
So
one.
I no. Do you have any idea what double bind is?
Offhand, no.
Then how are we going to answer the question?
Maybe I'll find it in there.
No, you won't. Okay. So double bind. Does anybody know what it is?
Mixed messages.
Yeah.
It's mixed messages. What theorist does it belong to? Do you happen to know?
Is it Jay Haley?
It is. Oh, look at you. Look at you. So Jay Haley did our strategic family therapy. It is how we talk to each other. The double bind is you give me these messages that just don't make sense. Okay. The kid that used to tell the mom tells the kid, well, of course I love you. Right. Or the kid tells the mom tells the kid this whole time, you got to go to college. You have to go to college. It's the most important thing ever. Go to college. And then when he's a senior, right, she ain't giving up no paperwork on his FAFSA. I ain't giving up my paper. But mama, you said go to college, but now you're telling me something different. Okay. So it's a mixed message. Strategic family therapy is how we talk to people. Remember the term, the paradox or the opposite, right? They prescribing the symptom. Those are terms that belong to strategic family therapy, which is sometimes called communication theory. Okay, now that you know the definition, let's read all four.
Number one, the mother is extremely angry and scolds her child while smiling and caressing her. Okay. Number two, the mother tells the child to wash up for supper and that he can use either the bathroom sink or the kitchen sink. Number three, a hostess serves fried chicken and a baked ham as a buffet supper and invites her guests to help themselves. Check that out. Um, a friend offers to help you move, but becomes ill and is unable to do so. Okay, based on what Ms. Smith had shared,
We're going to rule out, follow the same
I'm
process,
gonna
rule out.
rule out number four.
Okay.
Okay.
Now we're going to hope that friend's really ill, not that they would lie to us, right? Because no, okay, so 4 is out.
All right. Also, the other one, the mixed messages. Okay, I'm going to rule out number four. The hostess makes the chicken and a baked ham and as a buffet supper and invites her guests to help themselves.
You're taking 3 out.
Yes.
Okay. Now you're between 1 and 2.
Exactly. So, mother is extremely angry and scolds her child while smiling and caressing her. Now, that if I was a child, I'm a little bit confused. Why are you scolding me, but then also smiling and, caress me at the same time? So, I'm going to go between the two, and I'm going to go with number one as the one that I'm quite confused.
Now I'm a child of, my parents grew up in the spanking your beating your kid era. So that never made sense to me either. Like, how you gonna spank me and tell me you love me? That didn't make no sense in my head. Okay, I didn't say that back to my mama because I knew better, but it didn't make any sense to me. Okay. Okay, everybody good with that? So double bind communication belongs to strategic family therapy. I'm giving mixed messages. Make sense?
Mm-hmm.
Okay. Was that a term for most of you that maybe you didn't know before?
I think I just forgot the name.
Yeah, that's it. Okay, so we don't get to forget the name on the test questions. We really just have to know the verbiage, knowing the verbiage of who said what.
Mm-hmm.
Okay, 1 second. Okay, after Johnny would be Pamela. Okay, same process. Okay, question. In that last question, that was knowledge of family structure. Knowledge of family therapies. So that's what that last question was measuring. Okay, Pamela, this is yours.
All right. So a 70-year-old woman cares for her chronically ill 77-year-old husband at home. He has a degenerate disease that will eventually make him totally dependent on her care. She also has a chronic heart condition and fears that she cannot care for him too much longer. And counseling her and helping her plan for her chronically ill husband, a social worker should speak to. So, staying in the question, we are working with a 70-year-old woman, elderly woman who is working, who is taking care of her husband, who is ill, and she no longer believes that she can take care of him.
Okay.
And the social worker, they're making plans on what to do next.
Let's just pick up a couple of verbiage. So chronically ill means that he's like, it's been this way for a long time, right?
Mhm.
And what does degenerative mean?
I'm not for sure.
It's not going to get any better. It's going to continue to get worse. Okay. Okay. So again, when you're taking a test, don't just go by it. I don't care if you get the question right. When you're at home studying, Google it, add it to your list. Okay. Little words like that can cause you to miss a question. Okay. So, and when you're in the test, you don't have that option. But when you're taking test questions at home, which by the way is not studying, but when you are, go and learn the terms. Okay. We've got to increase our vocabulary. Jane Addams was upper crust, middle class, right? Upper class. She didn't ever plan on working. She was planning on just helping those poor people. Okay. So not written for us. So she's 70. Her husband is 77 and he ain't getting no better. He will eventually be totally dependent on her care. She also has a chronic heart condition and she's afraid that she can't care for him too much longer. Now I'm counseling and helping her plan, okay, for her chronically ill husband. I should seek to what? In my mind, I'm still thinking first. Okay, let's read all four.
Okay. Help her assess and identify the range of choices that are available to her and her husband, such as home care and residential care. Persuade her to keep her husband at home and arrange appropriate support, or monitor the situation and intervene as necessary. And is it a 4? Or is it just 3 answers?
No, I'm sorry, there it is.
Okay, and then number 4 say engage extended family members to assist her as her conditions deteriorates.
Okay, so what can I rule out?
Number 2.
Okay.
You wouldn't persuade someone to do something that they don't want to do. So that's out. Because it's the client's interest, what they want. Then it says monitor the situation and intervene as necessary. You're really not doing anything. So I would take 3 out.
Okay.
So then I'm back. I'm at 1 and 4. So I am going to go with because she's asking for help.
Good. You went back to the question.
I'm gonna
She
go
says,
with
hey, I
1.
cannot take care of him. Okay. So why is 1 better than 4?
Because you're linking her to resources, you're helping her, come up with a plan to help to find a place for him to stay.
I think you're making, I think you're adding that stuff up. It says help her assess. That's what I do first, right? Let's gather more information before we make any choices. Do you see that? So I'm assessing the range of choices. So I am not giving her anything yet. I am just saying, hey, let's assess what he needs and what your options are.
And let's look at them. Okay.
So that's assess before you intervene. So first questions are assess questions. And this one didn't say first, but you're always thinking, what would I do first? Everybody see that? What else is wrong with 4? Anybody?
It didn't mention anything about family members.
Ding. There's nothing in that question that makes me think they have family members. Absolutely. Absolutely. Very good. Okay. Everybody good with that?
Yes.
Let's get that. What was that measuring, by the way? What KSA was that one measuring? That was probably a code of ethics question, right?
Yeah.
Client self-determination. Okay, that's what that was probably measuring. Okay, every question is always measuring something that you learned in social work school. Okay, I am with you, Linda.
A worker reached agreement with an elderly woman on public assistance to move to an assisted living facility for the aged. The client talks about her fear of moving to a place where she will not know anyone and will be alone. The worker's best response. So we're working with an elderly lady on public assistance, prepared her for a assisted living facility. But she's has a fear of moving out and not knowing anyone.
Okay,
So the worker's best response is, don't worry, you'll make new friends. I guess you'd rather stay where you are. It seems like part of you wants to move to a more comfortable place and another part is scared and want to stay with people you know. Therefore, it's most older people feel just like you, but then feel better after they move. So I would eliminate one
okay.
and I'll eliminate two. It seems like part of you want to move. Feel scared, I want to stay with the people. I'm gonna pick. Wait, let me go back.
Sorry, let me get that out of here.
Or do you want to move to a more comfortable place? Another part feels scared and want to stay with people you know. Okay, I'm gonna go with 3.
And I want to tell you to prove it to me in the question. How come?
Because she talks about her fear of moving to a place where she won't know anybody. And
So if feelings are in my question, then what's my answer? It has to be feelings, right? So we said before we assess if there are feelings in the question, there have to be feelings in the answer.
Right.
Okay.
yes.
That is reflection also, right? She's bringing up the feelings in the question. So if my question has feelings in there, my answer has to address the feelings. If they're upset, if they're angry, any of those things, I have to assess the feelings first. Everybody see that? Yes, Dr. Pam, you're extremely brilliant. Well, thank you. I really appreciate that. Okay.
I was
Yes.
Questions, ask me questions.
I was reading that number 4, after you mentioned feelings, and yeah, you were right, but number 4 also mentioned feel, your people feel, but it's more like not toward how she feels. It's like people, yeah. You're
Okay.
right.
Do I care how most people feel?
No, I have to care about my client.
Exactly. I don't care what they got to do with me.
Yeah.
Absolutely. Absolutely. That's got nothing to do with me. Good. Okay. This is, oh my gosh, a programming question. Okay. I am with you, Latrell, I'm sorry.
When performing a program evaluation requested by a funding agency and designed to measure the success of a program in reaching program goals, it is best to have the study performed.
So
Okay,
stay to my question.
all right. Okay, so question is saying, in order to have the best, what's the best approach for have a study performed in which there is funding agencies designed to measure success of the program for reaching its program goals.
Got it.
Okay, so one, by acknowledgeable staff member involved in the program. That's one. Two, by knowledgeable management staff member. Three, by an outside program evaluation organizer or independent consultant. Or four, without the knowledge of the program's management. Okay, I'm going to take out four.
Okay.
So we are trying to find the best way. Okay, so. Okay. I'm going to take out three. Okay. Going back to the question. Okay. It's the best way to.
I'm gonna take out three.
Yeah, that's it. Yeah, three.
Okay, so I'm not gonna take that out.
We're not going to take that out?
We are not.
Ugh. Okay. Okay, so we're going to take out one.
So what's the assessment about?
It's a program evaluation for the success of a program.
Based on?
Study performed.
The key to this question is who's requesting it.
Oh, we got a couple of like that in the test, and I was like,
oh, okay. Okay, I see it now.
It's requested by the funding agency, the people that pay our bills.
I see it now. Yeah.
Okay. So if the people that pay our bills, they gonna come and they want to know if the money's in check and I, so who am I gonna have to do that?
You're gonna have someone on the outside to do that.
Or yes, I am. Yes, I am. Absolutely, I am. I sure am. When it comes to funding, we can't mess up our money because salary can't count.
No.
Or Barbara's stealing money and we don't know. When it comes to how the agency is funded, we're going to take that totally outside and let somebody else come in and do that.
Right.
Okay.
That one little word there.
And that one little word changes everything. It's our dollars. Everybody see why that's the right answer?
Yeah.
I see it. Yes.
That's a tough one. And if you'd missed that one word, that would have changed the entire question.
Oh, yeah.
Okay. If it's just an evaluation, they're gonna, come in and look at our books or something. There's no money tied in it. I could probably just let somebody else go do it, right? Mm-hmm. But if it's our money involved and there's one error and they're gonna pull our funding, oh no. Makes sense?
Yes, it does.
Okay. Everybody good with that? Now, somebody said something. I've had a lot of questions like this. Did I hear someone say that?
I did. I remember I have a couple of questions in my last days about evaluations, performance, and I was kind of like, yeah, but I can see now when you point out the funding, that's pretty much, missing, the word.
So remember those terms: cost of benefit, cost analysis. Cost benefit is money for money. The agency gave you money and they're looking at how you spend the money, right? We're making sure we got our money's worth. Cost effectiveness is we gave you this money. How effectively did you use it? You gave you this grant money to decrease teen pregnancy in your area. Did you really do it? Right? So program evaluation is either cost benefit or cost analysis. Cost benefit or cost effectiveness. The formative is when it's forming, when it's new, and the summative is at the end. At the summary, right? That's when someone says, hey, I really like your agency. Can you tell me more about it? Then I'm going to use the cost effective. I'm going to use the formative, the end. Okay. So that one, of course, was just knowing knowledge, right? When it comes to funding sources, that's an indirect question of how we run an agency. Okay. I am with Tony.
All right, I'm ready.
Is my question?
Maybe I'm not. Yes, I do. All right. A social worker is working in a couples therapy with a couple who has been fighting a lot. The clients primarily use you statements instead of I statements when communicating with each other. What would be the primary purpose of using the empty chair technique with the couple?
Okay, we got to do some ciphering up in here. What they asking me?
So a social worker is doing couples therapy with a couple that is fighting a lot. The couple's primary use of you statements. So they're pretty much stating you instead of I when communicating to each other.
What are I statements? I feel your behavior. I am hurt when you come home late from work, right? And I am worried when you don't call. So that keeps your partner from being defensive. So how I feel your behavior, I statements. Okay. And the empty chair technique, who does that belong to? Or what is it?
Is it Gestalt?
It is Gestalt, yes. And the goal of the empty chair is to what?
Ooh, I just read this like 2 days ago.
Most of you have used something like this in your practice, okay? So the empty chair technique is to get rid of the unfinished business, right? Whether it's an ex-wife, an ex-job, an ex anything that you can't focus on the here and now and going forward because you're still stuck in the past.
Closing? No.
Say again?
Like closing?
It is, but it literally is. You can have a person write a letter. You can do, have them write a letter and tear it up. But Fritz Perl literally had you talk to the chair as if that person was in the chair, saying goodbye to them. Gestalt is very heavy into feelings, and he wants you to stay with the feelings and really get it out so you could be a whole person. Okay. Okie dokie. So now I know what I statements are, and I know what empty chair technique is. Okay. So now let's keep going.
A, to reduce enmeshment and clarify boundaries. B, to help each partner get a better perspective of the other. C, to promote catharsis or emotional release. D, to teach more adaptive communication skills.
Okay. What can I rule out?
What does enmeshment mean?
Oh, somebody tell me. That's a clinical term. That's one you should know. Somebody?
Things are enmeshed together, like
Single.
Like what?
Single.
Got too much going on.
Oh, it's a structural family term when there are no boundaries. Okay, structural family when there are no clear boundaries. So we talked about diffuse, right? When you can't see the boundaries. So in families that are enmeshed, I grew up in a mesh family. If you watch any of my videos, I'll tell you the stories that, you know what, I was about 7 or 8 years old, and I was 10. And my grandmother, everybody sat under the family tree, after church, we're having some after church stuff. And my grandma lifted my shirt and said, "Oh, you're getting boobies," in front of everybody, like it was no big deal. No privacy, no nothing, because we're all enmeshed. We all just know there's not clear who's the mom and who's the dad, right? Drug and alcohol users sometimes, right? When you've got the little kids trying to parent. So it's not clear the roles. So that belongs to Mnuchin, and his job is to, he joins the family. That's the word I'm looking for. He joins the family, and he then wants to help set appropriate boundaries. Okay.
I'm gonna remove A.
Okay. Well, did you read all four yet?
Yes, but yes.
Okay. What's C?
To promote catharsis or emotional release. Well, because it says or, I'm going to say it's emotional release.
It is. It's a Freudian term. So when we have this, like all this stuff built up, we go, I just let it out. Let it out. That's a Freudian term. Okay. Absolutely.
So then we're left with B or D. So B says to help each partner get a better perspective of the other. And then D says to teach more adaptive communication skills. And I'm going to go with.
Let's go back to the question. Let's go back to the question before we decide. Okay. Between B and D, which can I prove in the question?
D as in dog.
Okay. And how's that come the right answer? What's wrong with A? What's wrong with B? You're right. It is the right answer.
The question doesn't say anything about them having a better perspective of each other. It's talking about I and you statements. So it's how they're communicating to each other.
It's about teaching them skills they can take with them, right? So if I will teach you how to talk to your partner, it's not just this one fight. In general, I've taught you new skills. Okay. Very good. Very good. Very good. Okay. Everybody good with that one?
Yeah.
It's a recall question. That one was a family therapy question. That's what that was measuring is, do you know strategic family therapy? That's where that question came from. The word just froze on me. Come on. Windows and my computer won't freeze. Of course it did. Oh, don't let me have lost it. Oh, shoot. Okay. Do that again. They'll recover somewhere. Okay, did everybody have their first question? Everybody have one? Yes? Yes, are we good? Okay, we're going to start again then. I'm going to start in the middle. I'm going to start with Pamela. Pamela, this is you. You might not know the name, but I bet you can figure out the term. Am I sharing?
Okay. Lawrence Schumann coined the phrase blank communication to describe any disclosure by a client of important or difficult information just as a session is about to end. Select one.
Okay, what's the question asking me again?
Okay, so the question is asking to describe disclosure by a client that is important at the end of a session. Describe disclosure by a client of important or difficult information just as a session is about to end.
Mhm.
Okay. So reading my questions, my answer choices, close-ended, B is metaphoric, C is hallway, and D is doorknob.
Mhm.
Um,
Rule out what you know for sure, that some words that you know that it couldn't be.
I know I never heard of hallway.
Okay, so we'll take that out.
And I never heard of doorknob.
Okay. Is this a closed-ended question?
No, because
What are closed and open-ended questions?
closed-ended is when it's just yes or no answers.
Okay, okay. So is this like a closed-ended?
I would say no.
Okay.
Say no.
So I'm just stuck between a B and D. This is just a term. Does everybody know this term? It's the doorknob at the end of the session. Somebody says, oh, wait, I got to tell you something. That's really a term. It's called the doorknob. And what do you do when that happens?
Do you address it?
I got a client for me. Adios, amigos. Your time is up. We can discuss it next week.
Next section.
No, got it. No, okay. You had 55 minutes to tell me. Oh, no. Okay. That's purposeful behavior on our clients. No, we're not going to reinforce that. Okay.
Okay.
Linda, I'm with you.
Okay. When using a qualified interpreter to provide services to a client who speaks a different language, a social worker should do all of the following except. Okay, a qualified interpreter.
Okay. So N does accept questions, right? I'm always going to figure out 3 are right and 1 is not.
Okay.
Okay. So look at the 3 right answers.
All right. Stand at the interpreter and face the client so the client can clearly see the social worker and that interpreter without having to move his or her head. I would scratch that one out. Avoid using slang expression or abbreviation terms that can be difficult to translate. I would scratch.
Okay. So we're not going to scratch anything until we've actually read them all.
Oh, okay.
Okay.
Ask the interpreter for his or her comments to ensure that the information is gathered from collateral contact and speak clearly with typical tone and volume so that the conversation does not appear strained or unnatural. So I'm scratching out all the except all.
Okay, so which ones are true?
Okay,
I'm
the
taking out
ones
the
are
one
true.
that are true. So which one should I take out?
A.
Stand near the interpreter and face the client so the client can clearly see the social worker and the interpreter without having to move their head. Why am I taking that out?
Because you want the client facing you
That's what it says.
and the interpreter.
That's what it says.
So that's why I want to take it out. Because I thought we was taking out all of the.
I'm taking out the one that is true.
That's true.
Okay, so this is true, correct?
It's
Okay.
true.
Okay. What else is true?
B is true. Avoid using slang.
Okay.
And ask the interpreter. Well, here's our, no, we don't want to do it. We want to speak clearly. We want to do D. So that one is true.
Okay. So then what I don't want to do
is C.
Very good. Very good. Very good. Okay, so that was why I just want to make sure that we're on the same path. That's how we answer those not questions. Find the ones that are true. And remember, when you're working with an interpreter, you always look directly at the interpreter, look at the client, not the interpreter, whether it's Spanish or a hearing impaired person. We're standing side by side, and the interpreter is always sitting across from me. Okay, we good with that?
Yeah.
Okay. Very good. Very good.
I have a question.
Yeah.
For the exam, is there ability to highlight and cross out, or I'm not allowed to do that on the exam? Like, is there a highlighter and a pencil on the test?
So tell me now with PSI. I don't know.
You can highlight.
Yeah, you can highlight and cross out.
Okay, perfect. Thank you.
Okay. Let's see here. Johnny?
A social worker learns that a family served by a agency is having problems. They are arguing a lot and have strained interactions. In the last year, the husband, who has had a long-standing problem with alcohol addiction, has been sober and actively engaged in treatment. He is working after being employed for an extended period. His family is most likely experiencing problems due to a change in.
What's happening in the question?
Okay. The question is saying that agency is having problems. They're bickering and arguing over the strained interactions. The husband has been in treatment for a good period of time and is now back actively working and things of that nature. So, A says homeostasis, B is entropy, C is complementarity, fancy, negative feedback loops. Okay.
Do you know what all these terms are?
I know what homeostasis is and complementary and negative feedback loops. That sounds, that's self-explained, I think.
I bet it's not. Tell me what it is.
Oh, okay. Put me on the hook.
I'm just want to try and get you past this test. We can't hang out forever.
Okay, all right. I'm gonna just say negative feedback loops. That sounds like no matter what I say, you have something contrary to it. You're not in agreement.
So that's what I kind of thought. So let's get the correct definition for the test.
Okay.
So in families especially, but everybody, when we talk to each other, I give you feedback. right? If I give you feedback, I've added something, right? So positive feedback loops change homeostasis. Okay. Negative feedback loops, if I say nothing, negative feedbacks, the system changes, doesn't change at all. So if you and I are having this group, right, and you tell me what negative feedback loop, you just gave me that definition, and I don't say anything at all, will your definition change? No. Yeah. So your homeostasis will not change.
Right.
Okay. We want your homeostasis to change. That's not correct. So negative feedback loops do not change homeostasis. Positive feedback loops do. That belongs to strategic family therapy as well, how we talk to each other. Okay. What is entropy?
I'm not sure.
Okay. Anybody else? What's entropy?
The dying process.
Okay.
Closed, disorganized.
Okay. So in a family system, give me an example of what entropy would look like.
Not changing.
Give me an example. A family starts to entropy.
An example with this example, do you have? Well, because there's most likely example to the change. So it has been changed.
No. Don't look at my question. Just so we have these are working definitions that we need to be putting in everyday life. You work with families all the time. They're about to fall apart. Right? Dad's an alcoholic, mom's an alcoholic, dad got fired, kids act in a hot mess. The family is becoming chaotic. And eventually, if we don't step in, negative entropy, the family will eventually die. Right? So negative entropy is to negate the dying process. Right? So then when I usually teach it and looking at my family videos, especially, you'll see that family systems theory says everything is interrelated. Okay. So again, this is terminology that really should be part of your everyday vocabulary. Go to work and tell your clients, that family's about to entropy. It's about to die. Okay, wouldn't use that term, but you are going to say, if we don't put some services in the home, defects may take your children away. Correct? That's what it looks like. That is entropy. So in a healthy family, okay, in a healthy family, what we see is, these are the boundaries. So mom and dad are in charge, right? So the dad and the mom, they're their own subsystem, and then their family subsystem. Below them, the children are in their own subsystem, and then together they're in a subsystem. And all the things that make this family survive is the input, right? Dad's job, the church, mom's friends, school friends, all those things. So if mom begins to drink and she stops taking care of the kids and she stops doing the laundry, and the kids eventually going to stop going to school, right? They'll get a knock on the door. Hello, this is social from defects. We got to take your kids. So that system, as we know it, is falling apart, and eventually it'll die. That is entropy, entrophy, right? Okay. When you put on your big old social worker cape, and you come in the house and you put services in the house, you've stopped the family from dying. That's negative entropy. Okay. Got it. These are family systems terms. That's where we're going. Okay. Okay. Now, so again, when you're taking questions, the goal is not to guess. I don't care if you get it right or not. I swear, it's learning. So you don't ever have to learn it again. You know that term, all of you, okay? Okay, so now, let's go back to my question.
Oh, well, if we look at homeostasis, obviously that's not happening right now because the whole family is bickering and.
Okay, is homeostasis a good or a bad thing?
That's a good thing.
It is not with the families we work with.
Oh.
So homeostasis is their norm, but it doesn't mean it's healthy. I get off every Friday night and I spend all my paycheck at on the horses, and now the kids don't have lunch money for next week. That's their norm, but it's definitely not healthy.
Okay.
Okay. So now read the question again.
The family is most likely experiencing problems due to a change. So,
Okay. The whole question, remember, not just the last line, the entire scenario.
a social worker learns that a family served by his agency is having problems. They are arguing a lot and have strained interactions. In the last year, the husband, who has had a long standing problem with alcohol addiction, has been sober and actively engaged in treatment. He is working after being employed for an extended period. The family is most likely experiencing problems due to a change in.
Okay. So in your own words, tell me again what's happening.
In my own words, the family is arguing and is strained relationships.
Okay. So now he
Mhm.
was in the last year the father had a long-standing problem. Now he's clean and sober. He's
Right.
working with after being employed for an extended period. Okay. So they're most likely experiencing problems due to what? Okay, let's rule out what can it not be.
Well, okay. I'm gonna rule out I'll be guessing. I don't want to guess.
Okay. So role theory, right, is role complementary. Right? That's so that I did this role, you do this role. Do you see anything question about the roles they've been playing?
No.
Okay, I'm gonna take that out then. Okay. Is the family dying, falling apart?
I don't see that.
Okay, I'll take that one out too then. So now I'm between A and D.
When we look at the sentence, they are arguing a lot and having strained interactions. But we also look at the part about the husband got himself clean and sober. He's engaged, he's working, he's doing what he has to do. So it seems as if there's an issue with the homostasis.
Ding, ding, ding. That's it. That's it. There we go. They were used to fighting. They're used to dad drinking. They're used to being a hot mess. And dad got sober and now it's quiet. And they're not used to that, right?
Right.
So they go back to the crazy. Okay. So homostasis is their norm. It's not necessarily a good thing. Some of our norms aren't good things, right?
Good
Okay.
point.
Everybody see how we got there?
Yeah.
Okay. That is homostasis. Again, that is a family, that's a structural family therapy question. That's their routine. Okay.
Structured family therapies. Okay, thank you.
You're very welcome. You're very welcome. Okay. Everybody good with that? Because again, you're not the only one that struggled. You're just the only one that had that question.
You know, I was thinking about the good thing that you mentioned, homeostasis. We always think everything is normal, but no, it's the norm.
It is normal to them.
And you know, the problems that we encounter in treatment, treatment for people who have addiction is that, okay, the man do not want to the family get involved, but he's sober, but then we find the wife when he go home, she don't understand what he changed. So now they start getting into more argument than before because she don't know what to do with this man who's sober.
Absolutely. Absolutely.
So
And sometimes we'll see, sometimes the kids will begin to act out because again, they're used to
exactly.
fighting. They're used to the police being there. Very good. Very good. Very good. Okay, Yushana?
Okay, a social worker who is employed in the after-school program documents in a client's file that he is having problems concentrating when completing his homework as a result of issues at home with his same gender parents. The social worker supervisor would consider this entry to be. So the social worker is working with an after-school program and has put some information in the file that the client is having problems completing his homework due to his same gender parents.
Okay.
So justification. Oh, the social worker supervisor would consider this entry to be A, justification for a referral to a family counseling agency. B, critical in understanding how to support the child within the program. C, inappropriate because it contains information not relevant for service provision. Or D, incomplete as it did not describe the nature of the problems experienced in the home.
So this is one I just have to go through each of them and figure out what is one of these things correct.
Ooh.
No.
Okay, let's see.
Okay, so I'm the social worker, right? I after school program, I'm doing my documentation and I write something. He didn't complete his homework. He didn't complete his homework because of an issue of his same-sex parents at home.
Right.
Right. So let's figure out what we can rule out.
It's inappropriate because it contains information not relevant for service provision.
Okay.
We rule that one out.
Okay. Why? That one?
Yes.
Okay.
Because it's like she's the social worker is already coming to the conclusion that that's the reason why, without doing.
Then wouldn't that be my answer?
Oh, yes.
So let's just keep going. Okay. It's justification for a referral to family counseling agency.
Mm-hmm.
Is that make sense? Is that
no?
Okay. So then, critical in understanding how to support the child within the program.
Yes, that should be ruled out.
Okay. Why?
To understand how to support the child because she hasn't done any, or the social worker hasn't done any assessment.
Well, she did the assessment, right? And the assessment, this is what she came out with, right? But does it, the fact that he has same gender parents, does that mean he needs more support in the program?
No.
That doesn't matter, right? There's no reason to add that. None at all.
Right.
Okay. So C is my best answer. It's inappropriate because there is no reason she should have mentioned that.
Mm-hmm.
Does that make sense?
Yes.
Everybody see that? Okay. That this needs to be in there.
Ooh, I'm gonna need some work.
No, you're not. You're anxious and you're not reading the question. That's it. You're anxious and you're not reading the question. Okay. So
yes,
learn to stay in the question.
Yes.
It's a skill. It's a reading skill. And what most of you have done, and again, I don't know you, I just do this all day, every day. Most people just try to read through quickly and just get to the answers. I think they can figure it out of the answers. And it doesn't work that way. I really got to understand the question. What are they asking me? If I can get through that part, if I spend more time in the question, okay. And I promise you, you're in the same boat and everybody in this group except Tony, because Tony hasn't taken it yet.
Mhm. Hmm.
Where am I going? I'm going back to you, Sandra.
Okay.
Oops. Okay. This is a recall question.
Okay. According to the secular gender theory, pansexual is defined as they're asking for the theory, gender theory, pansexuality. What is this defined as?
Do you know what that is?
Yes.
Pansexuality?
Mhm.
Okay.
Being attracted to the opposite gender, but not only engage in sexual activity with those the same gender. Being attracted to only members of the same gender through the life course. C, being attracted to others regardless the gender. As D, choosing not to engage sexual activity with either gender regardless the attraction. I will rule out D.
D is asexual. If I put a in front of a word, it negates the word. So asexual, someone that just doesn't have any sex at all.
Yes. I will rule out A. Okay. I will rule out B.
Okay.
And I will
So
choose.
I'm attracted to a personality trait. I'm attracted to people who are tall, poor, rich, whatever, but it doesn't matter what body they come in. Okay. Very good. Very good. If you think guys can hang out with me for a bit, I'm gonna go to about 8:30. Okay. If you need to go, it is recorded. Where am I? I am back to Tasha. Tasha. T-A, long A, Tasha.
In order for social workers to assist with addressing the power imbalance and systematic racism that are at the roots of economic and social injustice, they must do all of the following except. So basically, this is asking in order for us as social workers to help or to address power imbalance and racism or systematic racism within the economic and social injustice system, we should do what? Except in the answers.
Oh, tell me in your own words. What's it mean?
Basically to help those fight the power imbalance and the racism, systematic racism. What should we do?
Okay.
Which of the following should we or not do in this question?
Okay. Very good.
So A, use colorblind ideology when providing services. B, understand how social programs maintain poverty and institutional structures that limit access to wealth. C, recognize that racism is the glue that holds classism or poverty together and is maintained through structures and systems of racial inequity. And D, acknowledge that racism has a negative impact on all races.
Okay, so tell me what is true.
Okay. So I I would B is true. Understand how social programs and maintain poverty and institutional structures that limit access.
Okay, that is
Yeah.
definitely something I would do. Yes.
And also B,
Boy,
sorry.
boy, B
Yes,
boy.
boy. Yes,
Okay,
yes.
good, good, good.
Boy. And so going back to the question, assist when addressing the power imbalance and systematic racism that are at the roots of economic and social injustice. They must do all of the following except. So I would say use colorblind ideology when providing services
What does that mean?
or recognizing.
So we're down to B and C, right? A and C, right?
Yes, yes,
Okay.
ma'am.
So now I'm going to
going
compare the
over-
two to each other. Okay. And one
Yes.
is one is the answer and one is not true. So then what does A mean?
I'm not sure colorblind, or colorblind, but use colorblind ideology when providing services.
It means
So
to
just
say,
using
it means to say I don't see color.
right.
Okay.
Yes.
Is that a good
Or
thing?
see.
Go ahead. I will stop talking. Go ahead.
You want me to answer your question or
No,
go
just
through
you
the
keep
others?
going. You figure it out. Yeah.
Okay. Recognize that racism is the glue that holds classism or poverty together and is maintained through structures and systems of racial inequality. So following except.
What is my answer?
A.
That is not. So color
No?
blind. So yes, that is my answer. Colorblind is
Oh,
not
okay.
a good thing. We don't like that. So when we say we don't see color, that isn't, that's racism. That means you're not acknowledging that people are different. They think different. They act different. So colorblind is not what we want to be. So there's two terms that you might have seen before. Etic, E-T-I-C. That means I see everybody from my eyes. It's the worldview. That means people will say, well, everybody believes red. That's true, right? But does everybody get treated the same way at the emergency room? That's imic. That's the view we want to have. Okay. So if I say I don't see color, that's an insult. That is saying that you, as long as you act like the majority, you're fine. And we want to embrace difference. We want to be proud to be different. And it's our job as a counselor to always work on that. Remember, we're coming from the view of the upper middle class white woman. Okay, so while for us, it may be more common to always think about color, but from the majority of test takers, it is not. Okay. Okay, Tony?
Yes. After a fight with a family member, the client is court ordered to receive treatment. During the initial meeting with the social worker, the client describes frequent outbursts of anger and thoughts of seriously harming a family member. The social worker should first. So the question is asking, after a fight with a family member, the client has a court order that they have to come to treatment. During the initial meeting with the social worker, the client describes a lot of outbursts of anger and thoughts of seriously harming a family member. What should the social worker do first? A, explore the client's commitment to treatment. B, consult with the coworker about the client's statements. C, refer the client to an anger management group. D, determine the jurisdictional requirements for this matter.
Okay, do we understand all four of them?
Yes.
Okay.
These are not the answer choices I was expecting, but
so
okay. Let's
so
see
what's
what
happening in the question? What's happening in the question?
So a client of mine is court ordered to come and do treatment. During the initial meeting, during the initial meeting with the client describes a lot of outbursts of anger and thoughts of seriously harming a family member. What should the social worker do first?
And so I'm assuming it doesn't say that, but I'm assuming the whole family may be court ordered, right? It says after a fight with a family member, a client is court ordered. So, oh no, they're not related. So the fight is over here and the family member's over here. Okay. So now it's the first session and the client describes frequent outbursts and I really, really, really just want to kill them. Okay. It doesn't say that, but you know, okay.
Mhm.
So now let's rule out. What would I not do?
So I would not consult with a coworker about this client's statement because I'm like, I don't need to consult
Ding,
with
ding,
this.
ding. I'm the very best.
Yeah,
I do
I'm the
not need
best
help
social
figuring
worker.
that out. Perfect. Okay.
I'm not going to refer the client to an anger management group. I'm going to delete that too.
Okay.
It's not the first thing I would do.
So now between A and D, and they're both assessed, aren't they?
Mm-hmm.
They were okay. So what's the better choice? What do I assess first?
Oh. I'm gonna go with A as an apple.
I will tell you that's not the answer.
Oh man. And I wanted to go with D, and I was like, it just sounds wrong.
Okay, so why is A the wrong answer? Go back to the question.
Okay, after filing the family and client's report to receive treatment. During the initial meeting social, the client describes frequent outbursts of anger and thoughts of seriously harming a family member. The social worker should first determine the jurisdiction.
Do I really care about A?
No.
Why not? Well, get what words?
The patient is quartered to treatment.
Absolutely. I don't care if he's vested or not. Okay. Yeah. So if he's under, we've already court ordered to be here with me. What I want to know is what do I do with it now?
Yeah.
Okay. Did I mention it was a reading test?
And I wanted to pick D. Oh my gosh.
Okay, but no guessing. Go back to the question. Back to the question. They're giving me all the hints and clues I need in the question.
Yeah.
Okay. So in the beginning, I was really focusing on content. So now I'm focusing on, now we're in the how to. Okay. So it gives you all the clues. They are not out to trick you. Okay. Makes sense? Yes.
Yes.
Anybody else have anything you want to say on that?
I'm a little confused about that.
Okay. Tell me why.
Why do I need to have determination the jurisdiction requirement for this matter?
Because he is court ordered.
Okay.
Right. So now I need to go back and read the court order or call the probation officer or call the judge. So, you know, he's already court ordered for treatment and now he's threatening to kill somebody. What is the next step according to what the judge has said?
Okay, I got you. I have to go back. Yeah, he's described he want to hurt somebody. Okay. I got you. I got you.
So she picked A, explore the client's commitment to treatment. He's committed to treatment. He's court ordered. He didn't want to be there.
Right, but you know where's my confusion is, because usually, you know, when we have clients, they already have the court order. We already know the
Okay,
PO.
whoa. You saw your name in the question?
No.
Okay, I'm confused because I thought your agency, your name did I miss that?
No.
Okay, remember, keep you out of the question. Keep you out of the question. Okay.
I confused myself. I put too much in it.
Exactly. Keep you out of it. Keep you out of it. Honestly, that's the problem is we bring our stuff in our agency and the test doesn't care. Everybody takes the same test. Okay. Okay. Latrell?
Okay. A social worker is working with prospective adoptive parents and a 12-year-old child in their care pending completion of adoption. The parents describe the child as stupid and an idiot in the child's presence, despite repeated suggestions to discontinue these negative comments. The social worker should. This is an ethics question, would you say? So is saying, is asking what should the social worker do when they hear of the parent's child stupid and idiot, despite repeated suggestions for them to discontinue the negative comments.
Huh?
So
Hmm.
I have to figure out what I should do, how do I respond to that?
And I'm still thinking first, whether it says it or not. I'm always thinking, what would I do first?
Okay.
Right? That's
Okay.
rule out. Read all
Okay.
4, then rule out. Okay.
Okay. A, refuse to work with the parents unless they follow the recommendations. B, refer client to anger management classes. C, continue to educate the parents about bonding with older children. D, refer the clients to child protective agency due to possible emotional abuse. Okay. I'm gonna rule out refuse to work with parents unless they follow recommendations. And the reason being is because they've been told repeatedly to stop with the negative comments and they continue to do it. And refer the client to anger management classes. I'm ruling that out. And continue to educate the parents about bonding with older children, or refer the clients to the child protective agency due to possible emotional abuse. I'm going to go with D.
You are. And that does make it a code of ethics question, right? So I did, right? I said to them once, hey, this is not okay. And now I'm just going to say to them, no, no. You're trying to adopt this child. This is child abuse. This needs to be recorded. Okay. Very good. Very good. Very good. Okay, I'm going back up. Let's see here. Linda?
Social worker is preparing for an initial interview with an adolescent referred for behavior health services. During this first session, the social worker should. So social worker is in an initial interview with an adolescent referred for behavioral health services. What should the social worker do? Allow for a brief
Okay,
warm-up.
so hold on. So what does it mean in your own words? You read it twice, but didn't put it in your own words.
Okay. I'm working with an adolescent that was referred for behavioral health services.
All that means is therapy, right? That's all that means. He was referred for therapy. I don't know why. It's the first session. He's an adolescent. Okay.
Okay. So allow for a brief warm-up period to establish positive rapport. Indicate understanding of the client's presenting problem. Offer professional credentials, including experience working with youth. D, encourage the client to take the lead in the session. So let's eliminate C.
Okay.
Let's eliminate D.
So now I'm between C and D.
Okay. Let's behavioral health. That's the initial session. So we'll do A first. Allow for a brief warm-up period to establish positive.
Ding, ding, ding. So that's making sure you understand the social work problem solving method, right? So before we do anything, we're going to ask a little report. Then I'll start to ask him questions. Okay. Just knowing how we work. That's all that is. Perfect. Okay. Have you found tonight helpful? Have you learned some things about how it comes to just answering the questions? Even when you don't know, has it kind of shined a little light on some things? Yes.
Yes, it does. Yes,
Okay.
it does.
Stay with me. We're gonna do some more. We don't get to go yet. Okay. I was Linda, right? Okay, Pamela?
All right, so during the interview, a social worker says to a client, a moment ago, you was talking about your wife. Then you switched to your daughter's behavior, and now you're discussing your coworker. I am having trouble following you. Can we go back to the subject of your wife? The social worker is using which of the following techniques? So what is going on here is that you have a client and you are trying to get clarity of what they're saying. Because you're having trouble following them.
Right.
So I am going with because this is like,
Rule out. We're going to rule out.
so first we have negative feedback. Then we have confrontation. I know it's not B, so I'm going to rule out B. I know it's not C because it's not reflecting any feelings. We're not doing any feelings. So then we're at A and D, and I'm going with D because you're asking them to clarify what they're saying.
Very good. You can use clarification at any time where you have a conversation, because you don't want to spend the whole time thinking this is what it means. It means something totally different. Okay. Very good. Okay. Johnny, this is yours.
Ooh, it's tiny. Okay.
I wouldn't do that to you. Is that big enough?
Yes, it is.
Okay.
A social worker in a mental health agency has received a referral to provide services for a client who is court ordered to receive social work treatment for criminal activity that led to his probation. The client does not want to participate in the treatment process and has told the social worker that he does not intend to keep his appointments. What should the social worker do? Okay, obviously, the individual is referred to the services based upon his criminal activity, and the individual is saying, I don't want to participate at all. Okay, so A says she should respect the client's right to self determination and inform the probation officer that the client does not wish to participate in treatment. B, she should inform the client that since he is court ordered, he has no option but to participate in the in the treatment. C, she should provide the client with information about what services she can offer and let him know the extent of his rights and refuse services. D, she should encourage the client to try at least one session with her and then decide what he would like to do. Okay. First and foremost, he's court ordered there, but he obviously says, I do not want to participate at all.
Okay.
So at that point in time, D, I would rule out. She should encourage the client to try at least one session with her. No, he's already indicated he doesn't want anything to do with that.
Okay.
Okay. I'm going to leave B for now. She should inform the client that since he is court ordered, he has no option but to participate in the treatment. Okay, I'm going to leave that for now. C, she should provide the client with the information about what services she can offer. Well, he already refused that. He doesn't want anything to do with it. I'm going to take that right out. A says she should respect the client's right to self-determination and inform the probation officer that the client does not wish to participate in treatment. I'm going to go with that. In other words, she's going to inform the agent.
No, you're not.
I'm not.
You are not. You are not. You are not. Okay.
Okay.
So,
Yes.
do I who do I answer to?
I answer to the,
If they're court ordered, who do I have to answer to as a social worker?
she should inform the client that.
No, don't read. Just in general. If I'm court ordered, who at the end of the day, who do I have to answer to?
The court.
Ding, ding, ding. Does it say the probation officer?
No, it doesn't.
So that ain't my answer.
Got it.
Okay. This is actually verbatim code of ethics. So it's either B or C.
Mm-hmm.
But because we have to choose one, we're gonna go with B. If we have to
No,
take,
you're not. You always have an option, girl. I
It's
can't make
C.
nobody do anything.
Right.
Care what the judge says. If you have a magic wand, you ever tried to make a man do something? Be married. Shoot. Okay.
oh,
See,
no
it's a
wonder I get
verbatim code of
Easy
ethics.
answer then. C.
Verbatim, exactly what it says. Tell the clients, hey, I'm not part of the court. The judge ordered you here. Personally, I don't care if you show up or not. It's your little happy butt, not mine. Okay, I'm nicer than that. I'm gonna say, this is what I have to offer, and this is what the judge says. And then in 30 days, when we go back, the judge is going to say, well, hey, Dr. Pam, how did so-and-so do? I'm like, I don't know. It is that simple. It is that simple.
yeah,
Okay? We can make something. The judge can make you come, but can I make you participate? Gonna make you open your mouth? We always have choices. His choosing to go back to jail, obviously.
Mhm.
Okay. Everybody see that? That is a verbatim code of ethics. Exactly what it says. You good?
Mm-hmm.
And Dr. Pam, when do we inform the client at the first appointment of the service of like his right to refuse services and what will happen?
So in normal informed consent, I would. Right? Normal informed consent. So he's court ordered. So I still would say this is that, but he needs to know that everything he tells me is not in confidence. Right? I answer to the judge on this one. So he's got no assumption of privacy.
Mhm.
Mm.
Mm.
Okay. Okie dokie. Yashana?
In an initial interview, a client becomes belligerent and threatening for no apparent reason.
Been up 5 times.
Okay, make it 6 times and mute yourself.
Oh,
The social worker should first. Okay, in an initial interview, the client becomes belligerent and threatening for no apparent reason. The social worker should first, A, share his or her.
Say my question. Belligerent. What is that?
Just out of control.
Got it. And threatening. So it's our first session, right?
Mm-hmm.
Go ahead.
For no apparent reason, the social worker should first, A, share his or her concern with the client, B, firmly tell the client to quiet down, C, call security, D, ask the client to reschedule at another time. So I'm going to rule out D because there is a reason why the client is belligerent and threatening.
If I send him home, he's going to come back with a gun.
Mm-hmm.
Okay, so that is not the best choice.
Mm-hmm. I'm not going to call security right away. And okay. And I'm not going to firmly tell the client to quiet down. So my answer would be A. To
So
try to get to the reason why the client is belligerent.
ding, 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 ding. That's my assess question, or it could be even talking about the feelings. So before I do anything, I don't know why he's upset, do I? Don't have a clue. Shauna, you got that one right. Good. Very good. Very good. Okay, let's see here. Okay. Sandra?
A social worker receives a new client who's seeking cognitive behavior therapy, which is not the social worker treatment expertise. The social work should. The social worker receive a new client, but she's not have a lot of experience doing cognitive therapy. So what does she do next? A, attend this intervention, refer the client to an expert, explore the client's reasons for wanting cognitive behavior therapy, use his own technique when he trained to meet the client's need.
What would I do first? Okay, I know it doesn't say that, but we're always thinking, right? We get paid to keep gathering information. If I can, I keep asking questions. Okay,
Right.
So if I can't ask any questions, it's an intervention technique, right? Okay, so now what can I rule out?
D.
Okay.
I would rule out D because I cannot use my own technique.
I can, maybe, but just not first.
Right.
Okay.
Attend the intervention. I will do rule out A.
Okay.
Okay.
Now between B or C, which one of these things would I do first?
I will do C.
Ding, ding, ding. Assess, assess, assess. Very good. Very good. Very good. You got that right. Oh, how you feeling? You feel like you learned a little something,
Oh, yes. Really
Okay.
just like, oh my God, I've been blind. It is. Yes, you're right.
So honestly, once you get them, it's really not so bad. It's really not. I have to know content, but I have to know how to read the question. It's a reading test. I say it all the time. It really is just a reading test. Let me give you one that almost everybody misses. I'll start off with that. And I think if you've seen it before, don't answer. Okay. If you've seen it before, don't answer. I'm just going to read it. Okay. So a social worker at a homeless shelter is asked by a mother to take her children to the social worker's home on Christmas so the children will have a Christmas Eve in a nice home. The worker should. Okay. And again, I'm thinking, what would I do first? Okay. So then, A, take the children home on Christmas Eve. B, explain the ethical reasons why this cannot be done. C, call the local family service agency to obtain more support for the mother. Or D, spend Christmas Eve with the family. Okay. What would I take out? Let me start with you, Tasia.
So I would take out D. D as in dog, spend Christmas Eve
Okay.
with the family.
D is out. Okay, very good. Tony, what else would I take out?
A.
Okay.
As an apple.
So now I'm between B or C. Which would I do first? Pamela, between B or C?
Always assessing first. So
There's not an assess option in this one, so it's an intervention.
so there's children. I would say, I'll go with B.
B is not my answer.
No.
C is my answer. Tell me why. Anybody?
You say it's an interventions, so.
B is true though, isn't it?
Yeah,
B is true. It is
true.
unethical. It is true unethical. But how's that going to help that family?
Nothing. So that's why we have to, you know.
Okay. So
Yes,
B is absolutely true. But and this Christmas Eve, how is that going to help the family?
nothing. We're not gonna-
Okay. That's a commonly asked question. Most people are like, oh, well, we can't take them home. It's not about you. There's not one test question ever about you. It's always about the client.
I love how you said, what would you do first?
That's what you're always remembering. The problem solving process. We're always thinking assess, assess, assess. If I can't, there's a couple of reasons. And this one, when I got down to B and C, they're both interventions. There's no more questions, right? No assessing either one of them. So now it's intervention. What do I do? Okay. Okie dokie, guys. I think most of you I will see shortly. So again, it's a reading test. Stay in the question, in the question. It is not about did you get them right when you are studying. It's about did you learn? Did you learn about what's happening in the question? Okay.
Dr. Pam, do I gonna be able to go to the website and get all this information because I wasn't able to do it?
That's I haven't put it in there yet, but I will put it in there one time before Monday. I have had like back to back clients since Friday at 4. So I swear it will be there. Here, I will put
Need a
this.
doppelganger.
Shoot, I have plenty of staff. I just, yeah, I do. This is a thing in my staff that yes.
Okay.
I will put this one in there.
Waiting for Monday. No
Hold on. I will give this one right to you right now. And don't be patiently waiting for Monday at 8 o'clock because I have a staff meeting Monday at 11. So I don't even get to start working until Monday about after 11. So, but I'll put this in your chat box. You can have it right now.
Okay, no problem.
Thank you.
Hold on one second. Let me put this in here. This is Sunday social work. 9:29. Any questions? Anything in particular that I didn't go over that you just want to run by me? Anything?
No, this was very good. Very good.
Mhm.
Yeah, I think this was good.
Do you
And
see why
see,
you're missing questions sometimes? That you're overthinking, not reading, bringing yourself into it. There's all those things that we do.
I do.
Yeah, I
Okay.
could definitely say I have a little bit more clarity
Mhm.
when it comes to answering the questions and breaking them down instead of
Okay.
using like look at that last line before what you're
And
supposed to
I
do
know
or
one of
whatever.
those programs told you that, but that ain't gonna work. That ain't gonna work. They're giving you red flags. That's why I like the longer questions, because they give me more information. I hate those one
Yeah.
lines. I want to scream.
Hmm.
Okay.
Yeah.
Okay. You
yeah.
should be able to download it from the chat box. It's a Word doc.
Thank
Oh.
you.
Right click it, because once I hang up, it won't be here.
Okay.
Yeah, go ahead and put it on your dashboard now, so don't forget. Sunday out. Right there. Here we go. Okay, I will get this uploaded. I'm gonna try to do it right now. The video will take a minute though, and again, I promise you by Monday, but I can't promise you tonight.
Yes, sir.
Okay.
Thank
Okay,
you.
dokie. It's been a
And-
Thank you,
pleasure.
Dr. Pam. Have a good night.
And the readings for the book also, Dr. Pam.
Right.
So I'll put that in here too.
Okay.
So for everybody, oh shoot. One of the things I really think that you should do is read that. First of all, the APGAR book is the best. She's the best for content. I am not gonna lie, up, down, hands down, best for content. Okay. But I say start reading at the bachelor's level, because that really is simple read. And so many of the things that you're supposed to learn, you already should have learned at the bachelor's level. So that's the book we start with when you're really learning, especially those community questions, that content that you just need to know. Let me find that.
Thank you.
Again, I just put it there, but it won't be here when I hang up. So get it as soon as it downloads. There we go. It should be there.
Thank you, Dr. Pam.
Okay. My pleasure. My pleasure. I'll see you guys later.
Thank you.
Thank you.
Thank you.
Ooh. Good night.
Good night.
Good night. We'll see you next Saturday, I guess.
Good night.
Good night.
Yeah.